Families gather their school supplies, backpacks, clothes for the upcoming school year. Experts are recommending an addition to your back-to-school checklist, a mental health toolkit.
Joining us now for more in this sponsored interview is Amanda Chaudhry, the Senior Director of Pediatric Behavioral Health at Intermountain Primary Children's Hospital. Welcome, Amanda.
Thank you.
This is a great reminder because we're going through the checklist. We have all the supplies, but we also have to have that emotional conversation and make sure our kids aren't feeling anxious.
Yes, it's normal for kids to feel nervous and anxious about going back to school, but there's things that parents can do to help prevent that or reduce nervousness.
Let's talk about some of the statistics, everybody. 1 in 5 3 to 17-year-olds nationally face mental, emotional, developmental, or behavioral disorder. And last year, 43% of Utah youth who felt sad say they didn't talk about it.
Yeah, they didn't talk to anybody about it when they were feeling sad or even had thoughts of suicide. 40%, like you said, didn't talk to anybody about it.
So we need to keep having this conversation, getting it normalized. And what's the first thing that parents should do right now? A lot go back to school just this week on Wednesday. How do we begin that check-in?
Yes, well, that's one of the things you can do is build a routine for checking in with your child. Whether that's at dinner time every day or in the morning, talk about what are you most excited about? What are you nervous about today? What was the best part of the day or the worst part of the day? And build that into a regular routine where you're validating their feelings and talking to them about it.
So it goes a little deeper than how was school.
Yes.
Right? Because that's our typical, how was school today?
Yes.
You need to keep going.
Yes, and you might strike out the first few times with your child, but keep asking. Build it into their daily routine so they know that their parent cares every day.
So let's jump into the toolkit. First of all, you need to know there are resources, parents out there that can help you.
Yes, there are. So if you want to just talk to somebody about what's going on with your child, maybe you're starting to see some signs of distress, you can call ARCS. That's the Primary Children's Assessment, Referral, and Consultation Service. And it's a free statewide service. I tell parents to expect about a 30 to 40-minute call to talk to a mental health expert about what's going on with your child.
And what does the assessment look like? What does that entail?
Yeah, they'll talk to you, it's with a mental health expert, and they'll talk to you about what are you worried about as a parent. They'll ask you some triage questions to assess the acuity of the concern and where you're located geographically to match you to a resource closest to home, as well as be prepared to talk about your insurance coverage as well. We want to make sure that accessing mental health is as affordable as possible for families.
There's also a free in-home stabilization and mobile response. What is that and what happens?
Yes, you can call 1-833-SAFE-FAM. That's also a statewide service, and it's a mobile response team. They'll come meet you wherever your child's at. Usually that's at the home, but it can be at school, at a park, at grandma's house. And the mental health team will come on site and work with you and your child through a crisis and also continue for weeks of stabilization visits in home as well.
That's incredible. I had no idea that was out there where you can come directly to the crisis. There is, of course, the Utah Crisis Hotline, 988, we can call in case of emergency. But there's also the Pediatric Crisis Assessment available. What's that?
Yes, if your child is in crisis, call 988. Like you said, that's the National Suicide Hotline. And you can also take your child to the closest emergency department if you are in fear of their life. We have pediatric mental health assessments for kids in crisis available at Primary Children's Salt Lake campus, as well as Primary Children's Lehigh campus.
I'm so glad you're talking about it because I just think a lot of parents out there don't know these services exist. Is that the feedback you're hearing?
Yeah, it can be hard to know how to navigate mental health services. So calling that 988 number if you're in crisis or calling ARCS just to talk through what's going on with your child is a great place to start.
There's also partial hospitalization programs at Intermountain Primary Children's, and there's a couple of locations now.
Yes, we have a wide variety of services. So whether that's our day programs like partial hospitalization or after school intensive outpatient programs or outpatient therapy clinic appointments. We really have a wide variety of programs.
All right, to learn more, everybody, you can always go to primarychildrens.org or to our website, abc4.com/GTU. But this is such a great time to talk about mental health as we head into the new school year. And our thanks again to Intermountain Health for sponsoring this interview. We appreciate you being here.